Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster. My guest today is Fabio Saviozzi, co-founder at Enhance-d. Fabio, great to see you today.
Thanks for having me.
Why don't we just level set and explain to people what you've built at Enhance-d?
Sure. So what we built is a platform, dashboard and app that integrates all the data relevant to people with diabetes. So you have your CGM data, your insulin data, but also data from wearables or other typical apps that you use to manage your nutrition, your stress, etc.
Now, one of the things I love about your story is how you brought work from the world of elite athletes, and you made it available to normal people like myself, people with diabetes. I don't have diabetes, but just normal, everyday humans. Talk to me about that process and why it was important to use sort of that best-in-class information.
Absolutely. So if you think about managing elite performance, you really need data to support any single decision that you make. And this is particularly important where you have a data-driven condition like diabetes. So the more data you have at your disposal, the easier it is to make those decisions. The only problem that we experienced back in the day was there wasn't a single solution where we could bring all the data together to simplify our day-to-day decision making. Therefore, we started building a sort of solution by ourselves, and all of a sudden we realized there was quite a big need for this solution in the overall space, both on the clinician side but also on the patient side. And so we got together, we used our experience, and we started the project.
Very nice. So let's say I'm an average patient, I have type 1 diabetes, and I'm on your platform. Sort of walk me through that journey. What are some of the data points that I'm reviewing on my dashboard? How is it helping me day to day?
Absolutely. So if you think of what we're trying to do and what your end goal is as a person with diabetes, is to create your own unique fingerprint of your diabetes. Every person with diabetes is different, and every person's diabetes is also different. So it's really hard to make those general suggestions that you get work for your specific individual need. So first thing you do is you go on the platform and you start integrating all the data sources that you have at your disposal. CGM is becoming much more accessible these days. So a lot of people will have their own CGM device that will stream the data into our platform. Insulin, again, delivery systems are much better in providing Bluetooth integrations and data streams to platforms such as ours.
Like a pump that has a sensor that you can pull data from.
Yeah, or even a smart pen. As long as you can get the data automatically into the platform, then that's what we're trying to do.
So a smart insulin pen would send like a Bluetooth signal to the app?
Absolutely, yeah.
Got it.
And this is then stored in your profile. The data is not only stored, but also displayed in a way for you so that you can make decisions based on what you see. Not just insulin and glucose data, but also things like your nutrition, your exercise, your activity levels, your sleep, all the way down to stress management as well.
Yeah. I know there are other apps geared towards people with diabetes. What's one aspect that you think is particularly unique to Enhance-d?
So from a user experience point of view, we really felt that there wasn't a good system that was actually fun and engaging to use.
Okay.
If you look at...
You used the word fun.
Yeah, fun is important because if you think about our system, or our general diabetes management app, you're going to have to open it probably 20 to 30 times a day.
Wow. Just
to keep on top of your general diabetes management. And if it's the same dreary Windows 98 kind of experience, you're gonna get fed up with it quite quickly.
Okay. So UX, design is important to you.
Key. Yeah, absolutely. Design and also, ease of understanding. We have a massive respect for people with diabetes because they really became data scientists themselves with all the management they have to do. But this shouldn't be the case. It should be easier for them to reach conclusions and make decisions based on the data without, having to turn into an expert in getting the data together and understanding it.
You're a member of the Startup Health Type 1 Diabetes Moonshot community. Tell me what it's been like to be part of a collaborative group of people passionate about Type 1 diabetes.
It's been great so far. It's great specifically because all the companies in the group have the same goal, but they're approaching it from lots of different angles. And that's important because we feel that there's lots to do in the space still, and there's lots of help needed. And unfortunately, it is a growing condition, so the problem is only going to get bigger and bigger. And so it's great to network, but also discuss what could be some of the angles, what could be some of the potential partnership angles as well. And it's very refreshing because, sometimes as a startup, you feel that you're in it by yourself against, massive headwinds, and it's a refreshing setting.
Yeah. Where is Enhance-d in the go-to-market journey?
So we just launched our first product, which is the dashboard. Dashboard is both patient and clinician facing, and it's browser-based. Next up, by the end of the year, earlier 2024, we're going to launch our first app, and that's going to be patient-facing. It's going to streamline a lot of the user experience as well. It's going to complement the dashboard. So we envision a system where the clinician will have access to the dashboard, and then the patient will have the app as the main system they use, with also potential access to the dashboard as well.
Will you go direct to providers, to employers? Will you go direct to consumer?
We are going mainly direct to consumer, but going through clinicians as well. So our system is based on a subscription model where the patient can pay out of pocket for the use of the platform. Very low price point. We want to keep it flexible and accessible. And then the clinician can always access the platform for free. Eventually, as we move into medical device classification, we'll have reimbursement models available, but this is probably towards the end of 2024 in terms of timeline.
Okay. Who's an ideal partner for you? If you could be speaking to anybody through this video, who would it be?
Absolutely. I think the two types of partner at the moment. One is the hardware manufacturers. So really we want to integrate
CGM folks?
CGM, again, insulin, but even wearable companies. We want to have access to all the data, and this is to facilitate the use of the platform. We don't want any barriers in terms of if you're happy and comfortable with the wearable or the hardware that you're using as a person with diabetes, we should have access to that data, and we should be able to flow into the platform. So that's one type of partner that we are actively and proactively looking for. And the other type of partner is the large patient associations. So we really want to focus on the education piece quite a bit, and mainly starting from exercise, because we think there's a massive opportunity there to educate people to how to safely exercise with diabetes. And this is the type of support we've been asked for the last few years, so we want to make it available to the general population.
And that'll be a differentiator for you coming from the world of elite athletics.
Absolutely.
Right? Because you worked with a cycling team, right?
Yeah. Well, as a professional cycling team with people with type 1 diabetes, two of my co-founders were in charge of their performance and their well-being. And I would say some of the learnings we got there, but also working with, your amateur level athletes, or just people starting off on the exercise journey with type 1 diabetes. We know how difficult it is. We've been providing support to those people, because if you think about it, exercising diabetes, it's a high risk, high reward kind of situation.
Sure.
The benefits are fantastic, but there's also an element risk that it's just not there for the general population. And so we need to facilitate that, we need to help them through their journey, and we need to support them as much as possible.
I love that. Fabio, what I'm kind of reading between the lines is like, instead of an app that helps you just kind of stay stable and live your life, like how can you thrive, do the things that you love, like how can you stay even healthier?
Absolutely.
And you're coming in it with that elite athletics angle. People want to push themselves. They don't want to just survive with diabetes.
Absolutely. The thing is, if you look at all the things out there that could benefit a person with diabetes, I remember speaking to a clinician who told me, if you could bottle exercise, it would be the most prescribed drug in the world. Yeah. The benefits are just fantastic, but it's also very difficult for a person with diabetes to exercise safely and effectively.
Sure.
And so you add that entry barrier to what is normally an already existing entry barrier to exercise, and you're going to have, a population with either type 1 or type 2 diabetes that for the majority, in terms of 70% of the people are not active enough.
Yeah.
And you need to look at all the factors that you could influence in order to remove that barrier, and then support all the way through.
Awesome. Fabio, thanks for taking the time with me, giving me an update. Exciting to have you as part of the T1D Moonshot community, and we'll be watching your progress next year.
Fantastic. Thank you very much.
Be well.
Thank you.